Welcome back, everybody, to the GuideWell Insights Lounge. My name is Kate Warnock, and we are here at day 2 of Singularity University's Exponential Medicine. I'm here right now with a very distinguished guest, Dr. Thomas Graham. Dr. Graham, welcome to the interview.
Thank you, Kate. It's a pleasure to be here.
Dr. Graham is the Chief Innovation Officer at Cleveland Clinic. So Dr. Graham, you know, the numbers coming out of Cleveland Clinic Innovations are just staggeringly successful. You have $900 million in equity investments. You have 500 licenses and 700 issued patents. What is it that Cleveland Clinic Innovations does so well when it comes to commercializing breakthrough ideas?
Well, thank you. First of all, it's a privilege as well as a responsibility to translate the Cleveland Clinic innovation identity to the marketplace. And we're really the pioneers of what I would call mission-driven innovation. We understood that our brilliant physicians and our laboratory scientists conducting discovery were in excellent positions to recognize the unmet needs. It was then incumbent on us to build an infrastructure that allowed those ideas to gestate as close as they could be to the center of the innovation universe, where the patient and the doctor were getting together.
Right.
And so building those capabilities, the architecture to advance creative thought to its logical ending as a commercial product, really was the thing that probably would be considered the secret sauce of Cleveland Clinic Innovations over the last 2 decades.
Absolutely. So Dr. Graham, I know that you're an author and you have a new book coming out. Tell us a little bit more about that mission-driven perspective that you have in innovation. What do you hope that readers will take away from your new book?
You know, our CEO, Toby Cosgrove, wrote Cleveland Clinic Way and really talked about our model of care, a lot about our culture. We had a second colleague, our Chief Experience Officer, write about that very important component about taking care of patients. But then I was really thrilled to have the opportunity to discuss our history in innovation. People ask me, when did it start at Cleveland Clinic? I tell them 1921 when we were founded. But really, Cleveland Clinic has done really service, I think, to all academic organizations by blazing the trail on how innovation can be done in a traditional not-for-profit environment. And it's really about process. Innovation is not an ethereal creative wind that just blows through your corridors. It literally is a discipline to be practiced. And innovation, the Cleveland Clinic Way, that I wrote for McGraw-Hill, has given us an opportunity to tell that story. In it are very substantive and usable informations that can be employed. There are the tools and instruments that we've developed. We really want to share what we've learned. And so it really is a great tool, I think. It's an invitation to really join us on an innovation journey. And we all know innovation's best done at the intersection of knowledge domains, so sharing it seemed like the most logical way to do it, and the book really gave us the opportunity to do that.
You know, I'm sure that you cite in your book several use cases where you see the failures and the successes. What is it that you would advise entrepreneurs who are breaking into the healthcare industry to take an idea and really bring it all the way through to commercialization?
Well, first of all, innovation by its nature is a non-linear, sometimes very arduous, long to success, fraught with failure activity. I think people have to realize that. And that means there's nothing wrong with the fast, frugal fail. And I think you have to recognize that before you deploy too much time, resources, your own personal energies. But I think the thing that is really important right now for the innovator is to understand where the puck is going in all of healthcare. We have to understand that the innovative paradigm, when I started, I'm a fairly prolific inventor, and back 20 or 25 years ago, it was, I think I'll make this thing out of solid gold. Yeah. That's not the way it goes now. Right. We have to bake in value-based innovation, just as value-based care is important. We need to solve large problems for significant populations faster and frankly, cheaper solutions. And so if I would say anything, think about that early, because if you're doing something that's going to make the delivery of healthcare more expensive, chances are that even though the idea might be meritorious, you're really going to have to justify the cost element as well as that affects access and outcome.
You know, Dr. Graham, I think that your response takes us beautifully to my next question for you. What do you think is the most common misperception about the process of innovation?
That there's enough money. Frankly, there is enough good ideas.
Yeah.
We really are blessed at institutions like ours and our Global Healthcare Alliance partners that we have great minds working on some of the most important things, whether it's in population health or big data, pharmaceutical, medical device. But frankly, it's a tough proposition because we need what I would consider sub-economic or pre-commercial funding, and it's getting tighter and tighter. The lament of the investment community that things are too early and too risky, it really trickles down to our inability sometimes to fund through the important proof of concept gestation. So I would say that we really need to educate the entire ecosystem, the innovators in their institutions, the industry partners, investors who have largely disintermediated themselves, we need to bring them back, and then frankly elected officials need to participate. You know, the only new net job creator in our country are companies less than 5 years old. And any way you slice it, about half of those come from healthcare. If we are not only going to help improve and extend human life, but also use this as a lever for community economic development, we need everybody to be informed and be between the lines playing instead of sitting on the sidelines lobbing grenades.
Absolutely. Well, it sounds to me like you've really made a very compelling argument for exactly why Singularity University has convened this cross-section of the healthcare industry here at Exponential Medicine. Hopefully we have the right stakeholders in the room to really advance those innovations in the way that you see fit, and it's certainly going to benefit the biggest number of people. So Dr. Graham, thank you so much
what a
for
privilege to
joining
be
us
here. I thank Singularity, and I certainly think the things that GuideWell is doing in innovation is really groundbreaking. I congratulate you.
Well, thank you so much for that. Well, we look forward to seeing you again, Dr. Graham.
Take care.
My name is Kate Warnock. Please join us again in just a moment for our next live interview.